Hello students, I welcome you all to Obstetrics and Gynecology with Makla. In this module, we are going to deal about the second line of management of fibroid. In the previous module, we dealt about the medical management in treatment of fibroid. So, in this second module, we will be dealing about the second line of management in the treatment of fibroid. So, the first line of management was the hormonal or the non-hormonal management, which was intended to stop the bleeding, to prevent the heavy menstrual bleeding in that patient, and in order to relieve the pressure symptoms by decreasing the size of the fibroid. But despite trying with the medical management, the treatment has actually been unsuccessful. So since the treatment was unsuccessful, now we have to adopt the second line of management. And the second line of management in the treatment of fibroid is uterine artery embolisation. What is embolisation? Embolisation is nothing but you are going to obstruct the blood flow to a particular organ or a vessel or a particular mass. Okay, it could be anything. But the procedure is actually you are going to iatrogenically, you are going to create a block in a blood vessel, thereby preventing the flow of blood through that blood vessel to the intending mass, organ or something. Okay, yes, so that is the basic about embolisation. So now uterine artery embolisation is because we all know that the uterus, the major part of the uterus is actually supplied by via the uterine artery. So uterine artery is basically a branch of the internal iliac artery. So from the common iliac artery, the anterior division of the internal iliac artery gives rise to the uterine artery. So thereby, if you are going to obstruct the blood flow to the uterus via the uterine artery, by iatrogenically creating some obstruction in the uterine artery, you are going to result in decrease in blood flow to the uterus. So decrease in blood flow to the uterus will subsequently result in decrease in blood supply to the fibroid, and as the fibroid is going to lack the blood supply, it is going to shrink or it is going to decrease in size. In other words, it will result in necrosis of the fibroid. Okay, it is going to result in death of the fibroid. So this is the basic of this treatment. In this, I'm going to discuss about how are you going to do this procedure. So uterine artery embolisation is actually a minimally invasive procedure, right? It is a minimally invasive procedure. It is a non-surgical procedure, yes, and this has to be done by an interventional radiologist. This can't be done by a gynecologist. Uterine artery embolisation has to be done by an interventional radiologist. Right? Yes, because this has to be done under the radiographic guidance, such as the X-ray or through the injection of a dye. Under some radiological guidance, this procedure has to be done. So therefore, this has to be done by an interventional radiologist. So what is he going to do? So as you can see in this image, the main procedure is that first you have to create a small incision over the groin. So in the groin region, you're going to create a small incision, and with the help of a catheter, let's take like this is the catheter. Okay, so with the help of this catheter, you are going to gently introduce this catheter through the femoral artery. So let's say, for example, this is the right side and this is the left side, right? So through the right side, I'm going to introduce through the right side in the groin region, I'm going to make an incision in the groin. So through that incision, I'm going to introduce this catheter via the femoral artery. So I'm selecting the femoral artery of one side. In this case, we have selected the femoral artery of the right side. So through the femoral artery, I'm just going to introduce this catheter. And this catheter is gently threaded all along the way of the femoral artery, and it has to enter the contralateral uterine artery. As you can see here, I'm selecting the contralateral, that is the opposite side uterine artery. Please remember that in uterine artery embolisation, the uterine artery and the femoral artery of one side is not selected. One side femoral artery is selected. Through the femoral artery, you gently thread the catheter and enter the contralateral uterine artery. Why? Because is that if you're going to introduce this catheter through the femoral artery into the ipsilateral or the same side uterine artery, it is going to result in twisting of the catheter. So in order to prevent the twisting of the catheter, you have to enter into the opposite side uterine artery. So the procedure is that you are going to make a small incision over the groin on one side. Through that side, you gently thread the catheter through the femoral artery and enter the contralateral uterine artery. Now, through this catheter, what are you going to do? Now, I have to introduce an embolic agent. And the embolic agent of choice is polyvinyl alcohol. Right? So an embolic agent is introduced through this catheter. Now this embolic agent is introduced through this catheter and it is going to lodge in the contralateral uterine artery. So since you are going to lodge this embolic agent in the contralateral uterine artery, subsequently it is going to result in decrease in blood supply to the uterus. So you are going to introduce to one side, the catheter is introduced, it enters the contralateral uterine artery, you introduce the embolic agent such as the polyvinyl alcohol. This is going to result in embolization of the blood vessel, that is the uterine artery of the contralateral side. So this is going to result in decrease in blood supply to the uterus, which will result in decrease in blood supply to the fibroid, and the size of the fibroid is going to shrink. Therefore, the patient will result in decrease in pressure symptoms and the bleeding will also get controlled. So this is the basic of uterine artery embolization. As you can see here, so this is the catheter which we discussed until now. So through this catheter, the polyvinyl particles, that is the polyvinyl alcohol, is introduced, and this is going to result in embolization of that particular artery, which will result in decrease in blood supply to the fibroid, and eventually the size of the fibroid is going to decrease. Is that clear? Yes. So this is called as uterine artery embolization. Clear? Yes. So whether ipsilateral or contralateral uterine artery is preferred, the contralateral uterine artery is preferred. Why? This will prevent the twisting of the catheter. Twisting of catheter is prevented. So twisting of the catheter is prevented by selecting the contralateral uterine artery. Now, what are the indications for this uterine artery embolization? So uterine artery embolization is majorly preferred for whom? In those patients who do not want any further pregnancy. So any patients who have completed their family, and they do not have any desire for any subsequent pregnancy. So those who have completed their family, in those patients this can be done, because even though this is a minimally invasive procedure, the process is to prevent the blood flow to the uterus. So since there is going to be absence of blood flow to the uterus, so this patient cannot plan for any subsequent pregnancy as well. So those who have completed their family, this procedure can be done. And at the same time, those who are having excessive amount of dysmenorrhea because of fibroid, in terms of pressure symptoms, in order to decrease the size of the fibroid, despite the medical management, there is failure of the medical management to shrink the size of the fibroid. So now you have to select the second line of management, that is uterine artery embolization. By decreasing the blood supply, the fibroid is going to shrink in size, and therefore it is going to resist any sort of pressure it is going to put on the surrounding structures. Therefore the pressure symptoms will get relieved. So that is the basic of this pressure symptoms. Okay, yes. So this is also the treatment of choice for patients who are around the perimenopausal age group. Perimenopausal age group, the period of 4 to 5 years before the attainment of menopause, right? Perimenopausal age group. Right? Yes. And this is also the treatment of choice in patients with heavy menstrual bleeding. So majorly, uterine artery embolization have to be selected in a patient who have completed their childbearing. Yes, they've completed their family and she is around the perimenopausal age group, more than 45 years. Yes, she is an ideal candidate for uterine artery embolization. Is that clear? Yes. So now we're going to discuss about the contraindications. So what are the contraindications? So the most important contraindications are: the patient wants to plan her next pregnancy. So any desire for future pregnancy. This procedure cannot be done. And at the same time, if the patient is pregnant now, you cannot do this procedure. If you're going to block the blood supply to the uterus, it is going to affect the fetus as well. Yes, so any patient who is pregnant now, you cannot do this procedure. At the same time, in case of any malignancy, you cannot do that. Chances of the fibroid getting into malignant transformation is low, but then it is called as leiomyosarcoma. So in case of leiomyosarcoma, that is the malignant transformation of the fibroid, you cannot do this procedure. Yes, okay. And then what are the procedure? Any sort of infections, any sort of active pelvic infections, those are the contraindications, because you're going to increase the chances of infection getting disseminated. So any sort of pelvic infection is also a contraindication. And any fibroid which is very asymptomatic. So unless and until the fibroid is going to be asymptomatic, you are not going to disturb the fibroid. So once the symptoms is going to exist or initiate in that female, you have to consider the treatment options. So for asymptomatic fibroid, this procedure need not be done, right? So apart from that, what are the other contraindications? The other contraindications is any female who is in the postmenopausal age group. Why? Because is that we all know that after menopause, once the female is going to enter the menopausal age, there is going to be decrease in the amount of estrogen in her body. So once the female hormones are going to decrease in her, therefore this fibroid, which is estrogen and progesterone dependent benign tumor, this is going to shrink in size. So the only age group where you have to worry about the fibroid is during the reproductive age group. If the female is going to enter the menopausal age group, you need not worry about that fibroid, because subsequently this fibroid is going to shrink in size due to the lack of estrogen and progesterone in a postmenopausal age group female. So in postmenopausal age group female, you need not do this procedure as well. Yes, and in those fibroid which have increased chances of necrosis, such as those fibroid which are very narrow stalk, right? Let's say for example a pedunculated fibroid. What is a pedunculated fibroid? Any fibroid with a stalk is called as a pedunculated fibroid. The most common pedunculated fibroid is a subserosal fibroid. So any subserosal pedunculated fibroid which a very narrow stalk. So narrow stalk means the amount of blood which is reaching the fibroid is also going to get decreased. So since the amount of blood flow which is reaching the fibroid is decreased, therefore there is going to be decrease in size of the fibroid due to necrosis of the fibroid. So any fibroid which is going to result in necrosis and eventually shrink in size, you need not worry about that fibroid. So uterine artery embolization need not be done for this fibroid. So pedunculated fibroid, and that pedunculated fibroid is with a narrow stalk. Clear? So any pregnant patient, any patient who is wishing for or willing for any future pregnancy, any sort of active pelvic infections, malignancy, asymptomatic fibroid, postmenopausal age group female, and in case of narrow stalk fibroid which is going to result in necrosis of the fibroid, you need not worry about those. So for those conditions, you need not do this uterine artery embolization. Is that clear? Yes. So these are the entire details of uterine artery embolization. The only left thing is that what are the side effects you can anticipate in a patient who has undergone uterine artery embolization. So since the procedure is basically to result in decrease in blood supply to the uterus, which is going to result in decrease in the size of the fibroid, the patient could experience some sort of pelvic pain and some sort of discharge per vagina. Why? Because is that since the amount of blood which is reaching the fibroid is also getting decreased, therefore the fibroid is going to get necrosed. So because of this necrosis of the fibroid, the patient could experience some sort of pelvic pain after the procedure. So pelvic pain followed by some sort of discharge per vagina is common after the uterine artery embolization procedure. So this is all about the uterine artery embolization. And uterine artery embolization is the second line of management. Now, in this module itself, we are going to discuss about the third line of management, which is also very important. So, the third line of management in the treatment of fibroid, that is, despite trying the medical management, despite trying everything there is no improvement and everything is unsuccessful. So now you have to consider the third line of management. And what is the third line of management in the treatment of fibroid? The third line of management in treatment of fibroid is ultrasound focused procedure. What are those? Ultrasound focused procedures. So again, these ultrasound focused procedures are minimally invasive procedure. These are minimally invasive procedure. These are non-surgical procedure. At the same time, these are minimally invasive procedure. So we have two kinds here. One is high intensity focused ultrasound, and the second one is, as you can see here, magnetic resonance focused ultrasound. So this can be written in a short form like high intensity focused ultrasound HIFU or magnetic resonance focused ultrasound, as you can see in this image, right? So the basic of this procedure is that you are going to focus the ultrasound waves towards the fibroid. So once you're going to focus the ultrasound waves towards the fibroid, it is going to result in coagulative necrosis of the fibroid. So because of this ultrasound rays which are reaching the fibroid, which is the benign tumor situated in the uterus, it is going to result in coagulative necrosis of the fibroid due to the high intensity ultrasound waves or rays which are focused on the fibroids. So basic is that through the ultrasound waves you are focusing it on the fibroid. Since the ultrasound waves are focusing on the fibroid, it is going to result in coagulative necrosis of the fibroid. So once the fibroid is going to get necrosed, the patient will be relieved from the complaints of heavy menstrual bleeding as well as dysmenorrhea and pressure symptoms as well. Is that clear? So we have two things here. One is the high intensity focused ultrasound and the magnetic resonance focused ultrasound. In high intensity focused ultrasound, the patient will be asked to lie in the prone position. In the magnetic resonance focused ultrasound, there will be a device, as you can see here, the MRI table is held here and the patient will be asked to lie above the MRI table, right? So now what is happening here is that this transducer is going to focus the ultrasound beam over the fibroid. So initially you have to do the mapping of the fibroid. Following the mapping of the fibroid, you ask the patient to lie on the MRI table, and through the transducer, the focused ultrasound rays are going to fall on the fibroid. So as the rays are going to fall on the fibroid is going to undergo coagulative necrosis. So the fibroid will get necrosed. So this is the basic of this ultrasound focused procedure. Through the ultrasound waves, the fibroid is going to get necrosed, right? Okay. So the basic is that you are going to focus the ultrasound rays over the fibroid, and the fibroid is going to undergo coagulative necrosis. Is that clear? Yes. So now you may have a doubt that in which patient this option has to be considered. As we have discussed, uterine artery embolization has to be considered in a patient who has completed their family and who is not pregnant and they have no desire for any sort of future pregnancy. And in those perimenopausal age group female, this can be considered. Similarly, this ultrasound focused procedure should be considered in any female who fit inside the indications. So what are the indications? The indications are that the number of the fibroid, right? Number of the fibroid has to be less than 3 numbers. It has to be less than 3 numbers, and the size of the fibroid should not be more than 10 centimeter. Therefore, the size of the fibroid should be less than 10 centimeters. Size of the fibroid has to be less than 10 centimeter, and the fibroid should not undergo calcification. So the fibroid should not be calcified. So if the number of the fibroid which is situated in the uterus, either it is submucosal, subserosal, or it is intramural type of fibroid, the fibroid has to be less than 3 numbers, and the size of the fibroid should be less than 10 centimeter, and the fibroid should not be a calcified fibroid. So if the patient fits under the following criteria, the patient can be taken for this ultrasound focused procedures, which is basically a minimally invasive procedure where the ultrasound waves are focused towards the fibroid, and the fibroid is going to undergo coagulative necrosis, and therefore the patient will be relieved from the symptoms as well. Is that clear? Yes. So if any patient fits under this category, you can consider this patient for this ultrasound focused procedure. So in this module, we have discussed about the second line and the third line of management in the treatment of fibroid. The second line of management was uterine artery embolization. We saw in those females, in which sort of females you can take those procedures, and the third line of management was this minimally invasive ultrasound focused procedure, where we discuss about high intensity focused ultrasound and magnetic resonance focused ultrasound. So this was the second line and third line of management in the treatment of fibroid. I hope that I made it very simple for you through the pictorial depiction as well as through the very simple representation as well. In case if you have any doubt, similarly as I tell in every video, you just write to me in the Macular handle. I will reach out to you as early as been possible. So let's meet in next module with another interesting topic. So in the subsequent module, we are going to deal about what are the next line of management you can do in a patient of fibroid. Yes, until then, please keep revising whatever we have studied now. So let's meet in the next module.